Hi Instagram followers, Dr. Mark Beaty here at Beaty Facial Plastic Surgery, and we got quite a few questions from you guys this week, so I thought I would try to answer a few and give some insight to what you are interested in out there on Instagram. So the first question I got is, I'm interested in old therapy for slightly sagging skin around my mouth and eyebrows. I'm 40, is Ulthera the right place to start? Well, Ulthera is a great procedure that we've been using for about 7 years, and it's very effective for people with early aging changes, which typically we see in the late 30s and early 40s. It's very effective around the brows. In fact, that was the first place that Ulthera was approved for, and effective around the mouth as well. So the place to start is with a consultation, but it certainly sounds like that would be in the window for what you describe. Our second patient question is, if you get cheek filler and dislike it and have it dissolved, will this impact your skin, or will your skin return to how it was before? Another great question. You know, cheek fillers and fillers in general take up and add a bit of volume to your face, but it's not like it really stretches your skin out. And because this is a gradual process, if you do have to have filler dissolved, the skin's own natural elasticity will contract and help it to conform to the underlying contour. So that really is not a concern if you should ever have to have that done. Our next question is about surgical rhinoplasty. The patient asks, how much does rhinoplasty cost and will insurance cover it? Well, rhinoplasty is a very complex operation that can range anywhere from minor modifications to the nasal tip or to the dorsum to really complete reconstructions of the nose. And so costs are quite variable, and it is related to the extent of work that needs to be done and whether there's been any previous work done or previous injuries to the nose. Now, insurance can sometimes cover portions of nasal surgery, but these are going to be the parts that are related solely to the function of the nose. All of the portions of the procedure that are related to cosmetic improvement are generally not covered by insurance and are cash pay procedures. Our next question, can I do laser for my face in the summer? Okay, this is one of my favorite ones. That was kind of the standard wisdom for many years, especially back when I started practice 20 years ago or so. I really don't think it makes much difference what time of year you do laser resurfacing, particularly for those of us who live in the South, because you know what, we're outdoors and exposed to the sun pretty much year-round. So yes, there are some things you have to do post-laser treatments to protect yourself from the sun, but I think those things can be accomplished just as effectively in the summer as any other time of year. So I really don't view that as a restriction on getting skin resurfacing done. Our next question is, when should I start getting Botox? Well, it is now very clear from clinical evidence that using Botox as a preventive strategy against forming wrinkles, particularly in the upper face and the area around the eyes, is very effective. So in many ways, there's no time that's really too early to start using Botox. As soon as people begin to have some issues or concerns about the formation of wrinkles around the eyes or in the upper face, I think it's entirely appropriate to use Botox to help manage those areas. Our next question, if I have a vacation in April, is it too late to do CoolSculpting and see results? Well, we're talking now at the end of February. So typically we begin to see CoolSculpting results somewhere between 3 and 6 weeks from the time of treatment. So, you know, if you have a 6 to 8 week window, which with a vacation in April you do, then yes, you would begin to see some of the results from your CoolSculpting treatment. It probably would not be the complete amount of improvement that you're going to get, but yeah, it would be a good jump start. Next question, what's the difference between microneedling and microdermabrasion? Well, microneedling is a significant advance really from microdermabrasion. Microdermabrasion is designed to improve the surface of the skin by removing the very superficial epidermis and getting rid of some of that ashy, discolored material on top of the skin. Microneedling is a much more significant treatment where you're taking tiny little needles that are inserting actually into the dermis of the skin. And this directly stimulates the formation of new collagen in the dermis and helps make a lasting difference in the texture of the skin and pore size, and really is a much more significant treatment than microdermabrasion. And then our last question for this session is, how long do liquid rhinoplasties last? So liquid rhinoplasty is a term that's been popularized for using fillers to improve and make small changes in people's nasal contours. And typically the fillers we use for this are the hyaluronic acids. Now, in this particular location, there's not much mobility, so these materials last quite well, and we generally expect between 18 and 24 months duration of result, and sometimes even longer when we do a volume augmentation rhinoplasty with hyaluronic acid fillers. So that's it for this session of questions to all of our Instagram followers. I look forward to talking to you soon and answering some more things that are on your mind.